Hi, everyone. My name is Chris Sprague from Persimmon Health. I am a serial entrepreneur working on healthcare technology that helps more people access better quality of care. This podcast is for the movement of innovators, entrepreneurs, intrapreneurs, and thought leaders that are advancing the American healthcare system through digital health. In this podcast, we highlight real stories of innovators and enablers of digital health, their opportunities, challenges, and learnings for innovation. We'll cover topics such as startup building and fundraising, entrepreneurship, emerging technologies, and big ideas to transform healthcare. We invite you to participate in this community, share your stories, and accelerate the movement. Thank you. We have an awesome pod. Enjoy. I'm excited about today's podcast because it is our first podcast here at Persimmon with one of the healthcare startups that we work with, and that is CEO and founder of DocVocate, Singh. We're going to talk about his journey, his startup's journey, a bit about what claims are and why they are important, and a tip of an iceberg of problems for providers, and also Haynes' learnings and advice for healthcare entrepreneurs. Haynes, welcome to the podcast. We've been working together for about 2 years now with DocVocate. For our audience, can you please introduce yourself and kind of the shortest elevator you have in your back pocket around DocVocate, because we'll go more into that later.
Fantastic. Thank you, Chris, and thanks for having me today. This is exciting for us too, because we've been working together for a couple of years, and it's been fun to see how Persimmon's come together. Congratulations for putting that together as well. Singh, California kid, and always wanted to be an entrepreneur. Just a quick, bit on DocVocate is I come from a family of physicians. My brother's an orthopedic surgeon. My wife is a pediatrician. So I've really had come to understand the physician experience, and combining my Silicon Valley roots with watching how painful it can be for providers and patients to understand their insurance, let alone utilize it and pay for healthcare. DocVocate was born out of that, and what DocVocate really is we believe that the ultimate we live in a self-driving car, version of healthcare payments, where we all don't even think about the payments too much. We just go in, get our healthcare, and the payments are handled in the background, much like swiping a credit card at the grocery store.
Right.
And so, that's our vision. We're working towards that. So we're bringing automation to providers first, and helping them kind of collect revenue. And from there, we have a broader vision to help the entire system.
Awesome. I think we'll unpack some of those automations in a little bit. Now, our audience is healthcare innovators, wherever they are. They could be inside of health systems, inside of payers, or startup founders like you. And our mission is to help them succeed by learning about other innovators' journey. And I'd like to start by talking about your journey, and I think it's fascinating. You studied bioengineering and computer science, then studied and went into law, and now you're an entrepreneur within healthcare. Tell us about your journey from engineer to lawyer to an entrepreneur, and what motivated you along that path.
Thanks. It has been quite a journey, and I like to joke that with my family and friends that knew me back then that I'm much more like the younger generation today. When I was younger, I always wanted to learn more, and I took a gap. I took time between undergrad and law school, which now is the preferred route. So I did, kind of have a unique journey from the beginning. For me, when I went to college, I was very self-aware that I didn't know what I wanted to do. My father was an engineer, and I didn't really. I knew what he did, but I just knew what he did and not what other engineers did. So I was self-aware enough to pick a major. I love technical stuff. I have a technical, mind and interest. So bioengineering was really just a way to say I want to learn a lot. It was the most sort of unit intensive and broad technical major at the time at Berkeley, and so from the very beginning, I was setting up this sort of multidiscipline path, I think. It just turned out that I was in school during the dot-com era, and so I was lucky enough to join an early stage startup in 1999, late 98, 1999. I left school actually before finishing to join that startup. And, kind of quintessential .com. We were pizza boxes in an apartment, just, staying up late night, building a website out. And that experience was about a year and a half long before we came back to school. And that experience really, I think, laid the groundwork for where I am today, honestly, at the age of 19. Loved it. I loved every aspect of it and how you had to kind of do more than just kind of one thing. And, but also was humbled and learned that I didn't know anything about fundraising. And we got involved in some patent troll cases where we were just young and getting taken advantage of. And so I thought, okay, I have a technical mind, I have technical skills. I need to pair that with understanding the system. And if I want to be an entrepreneur that's going to stand on my own 2 feet, I need to have a diverse skill set. And so from there, worked as, like you said, as a computer scientist for 2-3 years, and then decided to go to law school to become an IP attorney and a patent attorney. So it has the technical angle, it's tied to innovation. I thought I'd work as an attorney for 2-3 years and pay off some loans and then move on back into the tech industry, and somehow 2-3 turned into 9-10 pretty quick. And so I was working, I got lucky to represent Apple and some other large, one of the major cases against Samsung related to the iPhone. And once I got into that IP world, I took to it, and finally, ultimately, at the back end of that, I went in-house at a tech company, a fintech company called Xero, 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 and was really, really lucky to be part of that growth story. And then I got reconnected with software and SaaS, and got to be part of their global leadership team, and saw how they built this business, got into payments a bit. It was at that time, that was 2014 to 2017, and it was in that window that fintech background got me looking into the revenue cycle. So I would go home and talk to physicians, and I did my day job. I'm into the fintech world. And that's really the combination of how the revenue cycle interest kind of happened. So I've even in performing DocVocate, I've taken some pieces of my entire journey. So at Xero, they did such a great job of working with accounting firms. We call them Xero evangelists. They're if the accounting firms that use the software love it, they'll sell the small businesses for us. And I've taken a piece of that. And so in DocVocate, in the name, we're advocates for doctors, right? And so we want to have the trust relationship with physicians that we are the first tech company that is really there for you. We're working with you, and we genuinely are that as well. So anyways, that's a bit of the journey, and at the end, how it all kind of came together, where I was able to then leave. I'm now a recovering attorney, and went full-time on DocVocate in 2017.
Yeah, that's great. Yeah, and some episodes of that journey sound familiar. I was the same way when I went to college. I didn't know what I wanted to do. Settled into an interdisciplinary major, and I was playing lean startup with my life since then until I kind of evolved to this point. But build, measure, learn each version of myself, and here we are. So you are also a active healthcare and entrepreneurial advocate yourself here in Oregon. And I would love to know what your thoughts are, big picture, on the current state of healthcare and how it needs to progress.
Yeah, it's a broad question in general, in the sense that we like to joke, other founders and I, that that healthcare is sort of 15 different economies in one and areas in one. And so, but there are some, I will say there are some underlying threads across healthcare as big picture. I'd say that, if you look at the moving parts in healthcare, one thing is just for certain, that there's more people, and there's more treatments and more ways that we can help people with new treatments. And at the same time, there's more and more economic pressure on the system to deliver all this new cool stuff that's expensive to create to more people and faster and a higher volume. Mm-hmm. So just right there, you have this tension that's been building up for a long time. The cost of healthcare plus the increased ability to help people. So how do you reconcile that? Then you layer in all the global economic and political complexities of today, of like all the healthcare systems are different, yet we're really living in a singular global economy, and the currencies and cryptocurrency and all. Now there's even more pressure on delivering it, within the context of your governmental regulatory framework as well. So I tend to look at it, when you just take a high level of healthcare, it's the cost of it, it's the delivery of the actual thing, and then as this regulatory economic environment sits on top of, and so with that being said, I think the general path for healthcare is the only thing that can reconcile all that complexity, really, or most of it, is technology, right? I mean, that's the only thing that can deliver more for cheaper over time. And so that's not even in our area. If you look at the clinical AI stuff, in the US, there's a lot of pathologists are being replaced with clinical AI. Parts of radiology are being supplemented or made more efficient by AI that can read images. So there's already parts of the clinical side that we're seeing the real effect of that now finally, which is awesome. And then, our area is the administrative side. I mean, nothing worse than, you can even understand that on the clinical side because that's the actual delivery of healthcare, but it's really frustrating that just giving someone insurance and having it pay for them, like that's causing all this manual waste and loss of ability to deliver care to people. That just feels totally unnecessary, honestly. And so, drilling down to our world, there's a lot of aspects of why that's the case and the complexity of the system. Ultimately, I think that will be like self-driving cars, once again, will be solved with technology and AI that can move all this big data and complexity in a way that makes it easier for us and more transparent, more fair. I think, if I had to, in a shorter answer, it's automation that brings all these complex pieces together and makes it easier for us to work. Yeah.
Right. No, that makes a lot of sense. And yeah, I want to dive deeper into DocVocate and exactly along one of those lines, which is one of those 15 or more segments of healthcare revenue cycle management. But as a prerequisite for our audience, I'd like to talk a little bit about fee for service, the prevailing business model in the US, and specifically about claims. So for our audience, what is a claim and why is that important?
Yeah, I mean, honestly, that is the unit of measurement, I think, for our system. So, it's the claim is basically a representation of a specific episode of care, you could say, or a specific event, a healthcare event. So I go to get knee surgery. There can be more than one claim that comes from that, but let's just say I go to get knee surgery. Then coming out of that knee surgery, a claim is going to be a coded, I guess you could say, file that gets sent to the insurance company saying, okay, there's a 99213 code that's associated with the visit. The implant that we put into Haynes' knee, that's a different code, right? The action of clipping his cartilage, that might be a different code. So there's diagnosis codes, but there's all these procedure codes, and all that's kind of shipped off to the insurance company, what we effectively just call a claim. Within that, also, there's financial terms. There's going to be amount that's billed. Like, hey, I as a knee surgeon, I did all these things on Haynes' knee, and here's the 6 codes that go with it. And with those codes, this is the amount that I'm expecting to get paid per our contract with Aetna or whoever. So that's all carried in that claim, and then it heads, that way. And then, but the claim's a sort of a bi-directional living thing. It's not like a single thing. It's so like I send a claim file, and in a way, the insurance company makes a decision. Okay, of these 6, I'm going to pay these 4. I'm not going to pay this one. I'm going to pay half of this one. And that comes back into a response, which is also kind of part of this claim lifecycle. And that gives you a sense. And the reason why it's so important is that's containing all the reasoning and the data and everything around how much something is costing and whether it actually, coverage actually happens or not. So much is controlled by that in terms of not just what the physician is going to get paid and what the payer is paying out, the insurance company, but also ultimately what you and I all owe out of pocket for that procedure is all dictated in this little kind of claims world. Yeah.
Yeah, got it. And so, yeah, I guess at a high level, it makes sense. Me as a consumer, as a patient, I have a agreement with my insurance provider that I'm going to get these benefits. If I use one of those care delivery benefits, then my provider is going to go ahead and bill that insurance company on my behalf. And they're going to get reimbursed. I'm going to get my benefit. However, we know that that process doesn't always work as seamlessly or transparently as it should. What can go wrong in that process?
Yeah, I mean, one of the simplest thing is that if you look at these diagnosis codes, there's 100,000 of them. And if you look at the procedure codes, there's less, but still in the thousands of these various codes. They're very granular, they're very specific. So on one hand, you have a lot of different ways that you can present a claim for the exact same procedure. So there's a subjectivity to it that the providers themselves have to make a determination, and then their billing teams on one hand. On the other hand, in our country, you have 4,000 plus different health plans, right? And so, and each health plan has different coverage, different and all that. And then the folks that are administering, let's just say once again, Aetna, they have 150 different health plans around the country, just to throw a fake number out there. Aetna has a system of making coverage decisions that are granular for each one of those 150 plans, for example. So you're talking about variability in how the claim is created, and then variability on how it's actually adjudicated on this side. And that is one primary reason where you have this quagmire of lack of standardization, you can say, in how they're actually handled.
Right. And I'm very interested in what seems like at the highest level, almost perverse incentives for payers and providers. Providers, of course, want to get paid more, and payers, or at least it would seem from the outside, want to pay less. So their incentives are almost the polar opposite of each other. And I may be wrong in categorizing that in such simplistic terms, but
Yes.
my question is, how do payers and providers collaborate, communicate, and compete when, at least from my understanding, they have almost opposite incentives?
It's a very fair base framework that you lay out. I think, qualifier, of course, on both sides of the fence, if you will, there's always going to be, a vast majority of providers in our experience are extremely honest. And I'll actually get into that. We did all these surveys early on with DocVocate, and compensation actually isn't the 1, 2, or 3 in the list of complaints for providers, believe it or not. So we'll walk into that on that side. But of course, there's some that are, and some that do overbill. There's cases out there that need to be regulated. On the payer side, same thing. There's folks that are more profit driven, folks that are more community driven. Of course, you just got so much on that landscape too. But you're correct in that in this ecosystem from the beginning to now, they are sort of it has been a zero sum game of lobbing kind of grenades over the fence of like, here's our claim, now pay it. No, we're not. And then I think everyone in the system agrees that's how it's been by and large. And, look, but like ultimately, I think at this day, and if we fast forward to 2022, I think there are many payers that are trying to say, hey, let's get more coverage for people. But we have, what I said earlier, we have to do it within cost. Like we can't, as an insurance company, we can't just generate 3 times the premiums from our folks and then pay everyone and just, right? And from the providers are saying, hey, look, you can even pay us the same. In some cases, you can pay us a little less. Their biggest complaint is the administrative nightmare, actually, believe it or not. On the provider side, in our country, there's physician burnout. People don't want to go to med school. The graduate rates are lower. But we've had a nurse shortage forever, and the pandemic has made that worse, right? So think about it. I mean, like when we were younger, Chris, like going to medical school was where it's at. It was like there's so many applicants we'll take in now. Like the applicant numbers have dropped, the quality of the applicants have dropped. Everything is, struggling because people don't necessarily want the life of going until you're 30, racking up a bunch of debt, working really hard, coming out, getting paid less, but then spending 40% of your time on administrative stuff when you weren't trained. It's just, and being sort of controlled by the system. And actually, so that's where we got passionate about the provider side of things. Okay. The payers are large corporations by and large. They take care of themselves. But naturally, corporations be more impersonal and profit driven. On the provider side, they're individuals, and they have lives. They're worried about the quality of life, and they don't have the capacity to deal with the complexities. And so, I think that gives you a little bit of the lay of the land. And, the reason with DocVocate's position on the side of the providers, they don't have resources. They don't have the resources that the payers do. So maybe it's more like a grenade and then like a larger bomb is being tossed over the fence. So we're trying to level that playing field in our base philosophy. But and I think you were kind of asking about fee for service, and I could talk about payment models, but I'll pass it back to you to make sure that I'm heading in the right direction for you.
No, you definitely are. Yeah. Let's circle back to those different business models, but maybe dive deeper into some of those pains that providers are facing. So it could be on the revenue side, it could be on just the administrative pain side. How does DocVocate help solve those problems?
Yeah, and so just to lay the framework right for everyone on the provider side, you've got inpatient, you've got these larger enterprise organizations like a Kaiser or like a UCLA or Stanford Health System, all the way down to like an individual that can have their own practice. I've got my own mental health practice, right, and everything in between. So one thing I'll say is that obviously as you go into the larger organizations, the providers are more salaried, right? Kaiser, all the providers are salaried employees at Kaiser. So DocVocate, we're 100% focused on the outpatient provider segment, which is actually more than 50% of our healthcare system, believe it or not. And but that includes surgery centers. It includes very large organizations, but they're just they run differently. On the inpatient, just for 1 second, on the inpatient side, let's just use Kaiser as another example. The physician journey and experience is very different, right? And I'd say that there's some great things about, say, my brother's a surgeon at Kaiser, so I know a lot, pretty well through him there, and my wife worked there for a bit too. But the pros are, well controlled, and in their cases, they actually do remove a good amount of administrative hassle for a lot of the providers. But on the flip side, they're salaried, and they're sort of you could say they feel controlled, whether they're not or not. They just feel like I'm limited in what care I can give the patient, because Kaiser has certain rules and frameworks and economics behind what they're doing. And so that feeling of being, controlled in a world where the gig economy and everyone's moving more to small businesses and controlling their time and what they do in their profession, a lot of those providers struggle with that. And we're, frankly, at DocVocate aren't helping with that today, right? That's sort of an inpatient health system thing. So moving into DocVocate in the outpatient side now, if the three of us were physicians and we wanted to start our own surgery practice, right? Now the administrative pains become large. We need to set up our own payer contracts with 30 different insurance companies. We need to hire a billing team, either they're in-house or outsourced. We can negotiate that deal. We need malpractice insurance. We have to hire staff and manage staff. We have to pick an EHR, pick a billing platform. There's just so much that goes into it. And 9 out of 10 providers tell you we're not trained in any of that. We're clinically trained. We're not business trained. We don't know, what's going on. And so what happens is where we're coming in and saying, okay, look, we're not going to solve all of that, but the biggest piece of that is follow the money, right? How much revenue can we generate? If you look at a physician practice, one of the number one expenses is going to be what they do to collect from insurance companies. How do we just collect revenue in general? So what we do is we come in, and if you're a large provider group, we say, hey, look, it's all about automation, and we want to be your revenue cycle automation partner. And we have some software tools that can help. We also have experience and knowledge in the space to give you more generalized advice. And so sometimes we started off with a consulting arrangement where we get to know their business. Okay. Every provider is a little different, but ultimately we're software providers, and we provide a tool that staples on to their current set system. So we're not coming in saying, change your base system, change it. We have this nice little clean layer that can interpret your claims data and find where there's gaps in revenue and allow your team to be more efficient for you in collecting revenue, and make the whole financial process more transparent to you. We have analytics dashboards and all that. So all of a sudden, as a provider, I'm like, all right, I've got DocVocate here. They can answer all my questions, any question I have for the most part. And also they can make reduce my bills a bit, and I can see where all the movements are in the financial aspects really, really clearly. So that's kind of where we sit in that whole world.
Got it. Mm-hmm. Yeah, and when you're talking about innovation in terms of helping reduce the administrative pain or helping more claims get paid, what are some of those common technical challenges in the new practices are inundated with these choices of systems and this broader ecosystem of billing companies or clearinghouses and insurance companies? What are some of the common big technical or non-technical challenges that those providers face?
Yeah, it's a great question. I think in the outpatient segment, you really got to focus on their billing teams, whether the billing teams sit in-house or externally. Let's just say either or, because the providers aren't actually working with the insurance companies. There's the billing teams that are doing it. And so I think the biggest challenge, let's just say it's an in-house team. You're a 100-person surgery group, and you've got a team of 50 people collecting revenue for you. I think that the challenge is twofold. If you're the providers or the leadership team, it's like, what is that team exactly doing, and how do I like even understand or follow what they're doing? There's a visibility problem, which leads to a management. What's the famous saying? You can only manage what you could measure, or something like that, right? So
Right.
very difficult to manage what you can't measure. So there's a visibility challenge there at the highest level. Then for the actual folks collecting revenue, there becomes this. They can only be as efficient as the system they're working on allows them to be. So when I mentioned earlier that there's all these 4,000 health plans and they're sending you these different responses, if I don't have a system that helps me filter that and triage all these responses from disparate health plans and payers, then I'm doing things manually, right? You're looking at claims one by one. So the system is what we look at. The technological system that a billing team works with is the foundation to the entire collection operation. It's like you're building a house. It's the concrete. Concrete's not there. That foundation dictates what kind of house you're going to build. And I would go a step further. The reason I'm personally and our team is so passionate about automating in this segment is I would argue that the financial and revenue cycle aspect is the foundation for the entire healthcare system all the way through. Even more than the clinical stuff is that you got to have that stuff in order. So I'd say that the biggest, broadly speaking, like how do I interpret all this information that's coming to me as a billing team?
Right.
That's the biggest thing. Yeah.
Okay. Yes. And where do you consider DocVocate in the stage of deploying your big ideas? So at Persimmon, we often categorize the startups that we work with by what stage they're in, whether they're at the beginning, showing proof that an idea has value at all, or they're establishing that they can be viable by getting customers to pay for it and proving to yourself that you have that product market fit. Or once you've done that, lastly, just growing, attaining scale by going after a market with more considerable energy towards, let's say, marketing and sales and bringing whatever that solution is to customers at scale. Where do you consider DocVocate in its journey?
Yeah, well, I'm and this a little bit behind the scenes, but I'm happy to report that I think we're squarely in that growth phase now. We really took our time to go through those first couple of phases that you mentioned, and that sort of patience, which we can talk about later in terms of maybe some advice to other healthcare entrepreneurs, but that patience and building through those earlier stages is now starting to pay off, and that our growth and scaling journey is a little bit smoother than it might have otherwise been. But yeah, we're actively scaling now. And to give you a sense, we made our first sort of major leadership hire in the business development sales side about 9 months ago. Then we just added a director of revenue who's phenomenal. Both phenomenal leaders. But we added our director of revenue about 2 months ago. She's going to be overseeing the sales and customer success aspects of the business, and so those are clear indications that we're ready to go. And it's been a good handful of months of being in this mode, and so we're feeling good now. Product market fit. We just got to grow, and that just means that now we look at our roadmap and everything around making sure that the customer experience onboarding is good, the customer support could be nimble, effective, but scalable and that kind of stuff. And we're doing so much stuff. Of course, we're doing all the other things, multiple products. I think multiple products is another thing you mentioned, I believe. And we've gone from 1 to 3 products now, and we've got a clear roadmap of 4 or 5, and so we're not just a point solution. And so yeah, it's a really, really exciting time now, and fingers crossed it goes well.
Right. Yeah, it's been an exciting journey together from a partnership perspective, from a learning perspective for us. And then also just a fan of you, Haynes, and watching your evolving success has been, great to be passenger side. Now, for the healthcare entrepreneurs that we have that are just about to start their own big idea, do you recall in your journey when you knew or you proved to yourself that you had something of value, that you had something interesting to work on? And, just some of that decision-making criteria where you said, okay, this is the one, it's time to lock in and start.
Yeah, it's in a way, it's a tough question. I think one thing I'd say is, in a lot of folks with founding a company and going through, especially in this kind of slow build that I've done it with, and sometimes you have to with healthcare. It's so complex, you can't just build something and have it scale. There's a few that have done that, but it depends on where you're at. I'd say in my case, pretty early on, before we even put pen to paper on the first MVP, I did a lot of customer discovery. I met with 20, 30 different practices, surveyed 200 providers, met with payers and EHRs, and started mapping all that together. And I think what's carried the day for me throughout the entire ups and downs of this journey is early on, I knew we were working on the right problem, or we were just rowing in a direction where things had to be rowed. So I'll give you a quick example. Early on, well pre-pandemic, like 2015, 2016, when I was just chatting with people. People were like, that's kind of neat with automation, but it's healthcare, and these are old processes. Is anyone going to adopt automation? And what is AI? They thought it was like a robot, and all that, right? And now through this process, I'd say just early pandemic, there was some understanding automation was going to hit, and through the pandemic, it's like now every revenue cycle department is looking for automation. They know the difference between machine learning and natural language processing, and right? So but for me, I guess I had a window that that's going to happen, and we're working on a big problem. And so even if there were some pains in adjusting exactly what our solution was going to be, I never wavered in knowing that we were working on something that mattered and kind of moving in the right direction. So that was the foundation of the whole thing. And then kind of more specifically with our platform, I'd say this is not going to be super specific, but I think there's this time, you want to have a learning mindset. Generally speaking, it's accepted with software. You got to meet with customers, you got to learn customers, you got to document all that kind of stuff. And that's great, but that can also be really tiring. It can really bog you down, because early on, inevitably, your customers know way more about their experience in the space than you do. And you run into a lot of I think I figured it out. And then someone shoots you down, and I think I figured it out. And so you keep this learning mindset. For me, every call, you got to always keep learning. But there is this tipping point where a larger percentage of your customer calls becomes you teaching them about the industry, and you kind of see the questions coming before they come, and you're like, wait a minute, and you get obviously more positive response than what you built. And I'd say for me, maybe it was probably only about a year and a half ago where I was like, all right, I've done enough of these customer calls and demos and interactions where 95% of what they're going to say I could tell early in the call, and they're getting value from the call, and then I could just tell their reaction. They looked at our product and that there's been a lot of thought and you've done your homework in building that. And that's when you're like, all right, you know what? I think we got something. And it would take a long time for someone to redo that, walk through our shoes to redo it. So I don't know, it's about a year and a half ago. I kind of was I had 3 or 4 calls like that one day, and I was like, I guess we got something here,
Right.
Yeah.
No, that's a great framing. I know we here at Persimmon, we come from the school of Steve Blank and Eric Rees, so customer development and lean startup and get out of the building. But I haven't heard someone frame it in the way that you have, that when you're going through that kind of customer development, customer discovery, when you realize that it's flipped and you're teaching them and they're not teaching you, then you probably know what you have. And I think that's a great nugget.
Yeah.
So speaking of nuggets, you've built something new and promising within healthcare from scratch. And that has taken incredible vision and grit and process by you, but it also can't be done alone. And you have to think as a new entrepreneur, how do you build a team, and what do you need and when? And I would love to know if you have any advice to share with our audience as to how to find those missing pieces and what you were looking for.
Yeah, it's a great question. There's an aspect of it, of course, that's going to be a little bit custom to what type of solution, even if you think outside of healthcare, even, right, if you're building a chat bot versus a workflow automation tool versus the mechanics of what are required, a little bit different. But I'd say if we're generalizing within healthcare, I think there are some commonalities. And so, in an early stage team, of course, there's a technical aspect to it, right? There's going to be the sales and marketing aspect to or understanding the market, I should say, aspect to an early stage company. And then, there's identifying customers and getting the customer voice in, right? And so I think the very first step as a founder or a founding team, the very first step is becoming self-aware about what skill sets do we have on board and what skill sets do we not have on board, right? I mean, it's very different to be a developer founder. In my case, I don't know what I am. It's some weird mix of that. And so what skill sets do you have on the team? What experience can you, networks can you, lean into? And so one of the things like, as an example, I learned the hard way is that, I'm actually not that much great of a market analyst, right? Going to Google and just putting in search terms and reading for a couple of hours is not like sufficient market analysis, right? But so if I had to do it again, I would personally pair myself and our early team with a great business analyst that could understand, break down the market and all that, and break down competitors and all that stuff early, and do that. So yeah, I mean, when I look at an early stage software company in healthcare, it's, do you have subject matter expertise? Is it claims, clinical, whatever area you're in? Do you have technical expertise? Do you have someone that has business acumen as an analyst and understanding strategy and economics of, the economics of what you're trying to build and do, right? Building a model and all that stuff.
Right.
And then someone that can do competitive analysis, what exists out there, and putting all that together, like, am I going to build something now that someone else is going to build in 18 months versus how do I think of a moat, of technical and business moat, right? And so if that's your framework, those are the core skills you really need to look at. And, when you look outside, I think really, really early on when you're just founding, you want to have those skills in your founding team, and then you want to outsource bits of that, I think, as much as you can. And then, of course, you get to this point where you're saying, okay, now I have a sense of an MVP. Like, I've talked to enough customers in our team, whoever that is I've looked at and analyzed the market. I've done that. I've built a tech team in some form. If I have a tech, founder, great. If I don't, you're probably not going to go hire W7, W2s, or 3 even to start your company. Mm-hmm. So I'm a big fan of looking outwards to companies, like Leapfrog, like Persimmon, like other folks that have the experience of working with people just like us over and over and over. And you can, in one phone call, you can learn about a lot of, you can avoid mistakes early on, and you can save your powder to kind of build your MVP. So I think that's the way I look at it is those three core tenets are, what is the market, understanding the market and the kind of competitors. Right. 2 is talking to your customers, understanding the scope and meets and bounds of an MVP and what it would take to build that, and then having a tech partner that can actually then help you, figure out the budget and timeline to get there. I think that's right there. And if you can do that with at least as little pain as possible, and you'll learn so much. You give yourself a chance to, take the next direction from there, I think.
Yeah, no, that makes a ton of sense, Haynes. And as far as identifying your own gaps, whether they be internal in your own team or the partners that you're working with, for example, with technology, and how do you conceptualize and get to the point where you have an MVP? Now, of course, but what we find is that a lot of entrepreneurs underestimate the challenges of getting to market. So the truth is that having an MVP isn't the end of the journey, but rather that new beginning in which you get to validate and iterate, but most importantly, get your first customers. So do you have any advice for healthcare entrepreneurs that maybe have not gotten to the MVP phase yet on how to think about going to 0 to 1, not just in terms of design and MVP, but in terms of 0 customers to even 1 or multiple customers?
Yeah. This may be a little untraditional, but one thing I can share about healthcare for sure is that it's very relationship driven still, and I don't see that changing in the short term. So I have many amazing uncles. One of which though it tends to drop some nuggets. We all have a couple of uncles that give you or aunts and uncles that give you that good advice that somehow your parents
right, the straight shooter.
Yeah, right. So he taught me when I was young, like, hey, listen, warm intros make the world go round, right? And I think that applies more so in healthcare than anywhere else. And so I think when you're early on, focusing on the relationships and getting warm introductions to possible customers is the best through your network or one way or the other, building the relationships. And I think that's critical because that's a skill set you need to develop to have to grow your company anyways. You're not going to, most healthcare software companies aren't going to just like build something and people like, that's so cool. And just put up a website and do some SEO, mark Google AdWords, and like everyone starts buying it. That hasn't really been a successful path for most healthcare startups. So if you're doing something, if it's relationships, you got to build that skill set. You got to build that network up a little bit anyways. You might as well start early. And when you get a warm handoff to a customer, whether it's a health system with more red tape or it's a solo practitioner or small billing company or whatever it might be, that warm introduction, whereas relationship based, they're going to give you more of their time and they're going to give you more genuine feedback, which is what you really need early. And then once you've done one or two, you've made enough of those, then you'll also probably know an efficient pathway to get, I don't want to call it more cold intros, but a pathway to get to, once you've met one orthopedic group, now you have a little network, maybe you understand them better, you can figure out how to walk into the next one and say, hey, I'm working with so-and-so, I understand that this is your spirit, you can empathize with them more, and then you can do it, customers 3 through 5 become a little bit easier to get.
Yeah, that makes a lot of sense. And I think that's one thing that holds for even outside of healthcare, but doubly true within healthcare, is just hacking your way to those first early adopters, evangelists, customers, and then using that as a beachhead to scale into more. But there's no, that I've heard, easy way to get that first customer.
No, I mean, one thing, and we haven't talked about fundraising, which is another challenge, but like for early stage entrepreneurs, but one thing I will say that a repeat, or now, like, I guess, I don't know if I'm experienced, but not as much. When I talk to more experienced founders, you can see that once they've gone through the journey, once you build a set of relationships and experiences, and then you understand who to go to. It's like when I was starting, if someone gave me the advice I just gave her now, which is go to your network, right? I would be like, okay, if my customer's a doctor, I'm going to go to a doctor to introduce me to another doctor, right? Like you just whatever. I mean, who do I know in my network that knows doctors, right? That's your first gut. But then you don't realize, I didn't understand the fundraising ecosystem. But it turns out investors are fantastic ways to get in front of folks. So like if you think about in the investor ecosystem, you're a venture capitalist, you're seeing, I don't know, 1,000 pitch decks a year, and you're meeting so many people, and then you're investing in X number of companies, and you're sitting on their boards, you're introducing them to people. You're effectively the ultimate relationship connector. That's just one example, right? And if you're an investor, what are you trying to meet? You're trying to meet founders, and you're trying to figure out, and so most really good investors, and if you go to fundraising, I've watched some VC training sessions and stuff, they train VCs to say, hey, listen, even if you're not investing in someone, build a relationship, be useful, make introductions. So they're being trained to make introductions to you. So finding the right investors in the ecosystem that you're trying to build in, and then building a network there, that can be a one-to-many connector to customers and other people, marketing firms, obviously engineering firms and stuff. So I think that's one example of you start to know where to go to make the most efficient connections as well.
Right. And do you have any more tips on the investment side for healthcare entrepreneurs that are at that early stage, or their friends and family, and they're looking to get external money? It could be seed stage, angel, or it could be they're ready for venture, on how to position your company, or when to position your company, or how to navigate yourself into investors that you don't have in your contacts list.
Absolutely. Pre-seed, like early kind of MVP stuff, the one rule of thumb is, to the extent you can do that with as little capital as possible. I mean, there's some types of businesses you can't, right? I mean, it just takes a certain amount. But if you can get to an MVP or some kind of proof that gives you, some amount of work with customers, market, that stuff we talked about, limit the amount of dollars, self-fund, some of that if you can. Get investment from your personal network, or from, the easiest to get money that's also smart money. So, to the extent that you can get money from an angel investor that's in your space easily, that's better than just a random check, because it's smart money. That's great, right? But early on, I think you don't want to spend a whole ton of your time chasing down money. You also don't want to get into the habit of overspending. Like, it can be a kind of a blessing and a curse. Someone just writes you a couple $1 million early, especially as a less seasoned entrepreneur. The tendencies to be like, okay, let me look at my budget now. I have a certain amount. Let me just hire a marketer. You start to overspend and lose focus. So I would say early stage, if you can minimize, simplify the fundraise, there's that. Now, once you evolve from there and you say, okay, now I'm moving on to the seed stage, or I need to raise a bit more to build this product out, to actually start to build a little more of a team. Then, I think at that point, it's a complex ecosystem out there. There's a lot that goes into it. I would just say that there's pitfalls. There's a lot of pitfalls out there. And so to the extent you become educated and understanding the difference between a venture capital investor, seed investor, strategic investor, every major corporation has an investment wing now, a family office. Like, it took me a while to figure all this. I would learn the vocabulary and vernacular of the investment world. What are they? You have to put yourself in the investor's shoes and understand what they're trying to get out of it. And that'll facilitate your conversations. That's one guide. Once you get into that stage, that's one piece of advice. Second piece of advice is don't ever take any, investor conversation personally. I've seen so many founders and myself, we're human beings, only so much rejection you can take without it kind of bugging you or making you feel bad. But the best analogy I heard with investment for founders is speed dating. It's like, just picture you're in a speed dating environment. You're not taking each interaction personally, and it's sort of a matchmaking game. And eventually, you will build a network, and you'll find someone who sees your vision, aligns with you well, who genuinely wants to help. And so there's a little bit of understand the process, so you're not you're talking to the right kind of folks. Don't take it personally. And then the last thing I'll say is you got to learn. I was late to the game on this personally. I went into this as I'm building my business. I'm an expert in claims and our revenue cycle. Fundraising process is about taking money in to help support what I'm doing here, right? And maybe getting some advice high level in my business. But what I didn't realize is that similar to them being connectors, they're a wealth of knowledge. And so let's just say you got a 45-minute Zoom call scheduled with the potential investor, right? Typically speaking, when you do enough of them, 10 minutes in, both them and you know that whether there's even a chance that you'd ever actually work together, right? Whether to invest. And
right.
It can be a tendency for founders early on to just be turn off once they're well, this is, it's like a speed dating. I'm sitting there, this is not a match next, right? And so I would fight against that strongly, because the idea is that you have 35 more minutes on this call. And that investor has seen a lot, and they may not be right, but then you learn to go into that mode of asking questions. And even if they know you're doing that, they like that too, and they're doing the same. They're asking you questions to learn about revenue cycle and things that, right? It becomes a bilateral education session, and more. The investors are always educating themselves. Many founders are not educating themselves, right? They're so in their world. And I built a network. I learned so much about my space and things outside, just talking to investors in the last 2 years. And so, that would be 3. There's no secret sauce is getting your money from here. There's no one size fits all answer, but it's don't get bogged down, learn a heck of a lot, and definitely learn the vernacular and their perspective, because a VC call is very different than a family office call, right? So those are some 3 kind of things there for you.
Yeah, that's great. And I think that accelerated learning you can get from those kinds of stakeholders in the ecosystem can be great. Is just don't just take the rejection, but as you say, ask why not, and what do you think is worth investing in the same space I'm in, and that'll help you iterate yourself until maybe you become that, or maybe you just know how to address that in your pitch up front. But I think that's a great advice.
Fantastic. Yeah.
So is there any other advice that you have for healthcare entrepreneurs or innovators that we haven't covered?
Yeah, I think the only thing I think that comes to mind is what we started off with healthcare being this complex ecosystem. And I think when I talk to folks in their own area, I've noticed that folks that don't get caught up in their own, just understanding their sliver of healthcare, I would say that if you're a healthcare entrepreneur, yes, know your area. I'm building a clinical tool, for this, that, and the other. But always thinking understanding the broader system and systems is a really, really important thing in healthcare, and making relationships and being curious about something that's going to inform a lot. So, you might be building something clinical, but if you don't understand how Epic works and Epics and 70% of the hospitals, then, right? And you don't understand what drives Epic and their partnership ecosystem as one example. You might end up picking the wrong strategic move, right? Because you didn't understand the other forces that were impacting your area. So I think something that's really unique in early in the journey, the earlier you could do more of that discovery and meet people and research, I think that's really critical. And then kind of a corollary to that is because of the complexity and call it the dependencies within this crazy thing, I like to call it jungle, right? This jungle that is healthcare. I think that if you have to be patient in a lot of cases, because in healthcare, with that complexity comes, as we all know, investors will tell you it's not easy to sell into healthcare. The customer acquisition cost is high, and it's heavily regulated with HIPAA and all that stuff. So more than other areas, you have to, I think, more often than not, come in with the long game in mind. You know, there aren't really any quick flips or too many in healthcare. So those two go hand in hand, right? Are you curious with the broader thing? Are you going to have the patience to learn, put those pieces together? And then are you going to give yourself the requisite time to see this thing out? I think those are the two things that are somewhat, you know, at least they might apply to 80% of the healthcare entrepreneurs. Yeah.
Right. Yeah. And I think you're exactly right about that, Haynes. One example we come across commonly is, for example, in the remote patient monitoring side, there may be brilliant researchers or people that can manufacture devices that are medical devices or new wearables, but they don't understand how they can actually be used, right? So they don't understand the software that it may take in order to be able to get that monitoring either to a patient or their caregiver or to the physician that needs to make a better decision. They may not understand the ecosystem of actual adoption and care collaboration. So who is going to really use that information within a health system? Oftentimes, it's not going to be the physician because they're too busy. And then third is touching on revenue management is, okay, what is the incentive for physicians to look at this at all and providers to support those programs? Are they going to get paid? Is there a billing code for this thing? And if so, what evidence does your device need to be able to provide in order for them to be able to bill? And I think, so what you said is right on. We went to Vive, one of those big startup healthcare innovation conferences in March, and there were so many new devices, and they had amazing technology of how they were going to make the actual remote monitoring of patients just more seamless and organic, which is, we believe, one of the keys to adoption. But saw a lot of question marks in the middle as to how it was actually going to get deployed within a health system or how it was going to be adopted and paid for. And I think what you said is right on. When you understand more of those ecosystems, you're going to have way less blind spots. And as you said earlier, gosh, the foundation is the bottom line, right? Is how do people actually get paid that incentivizes and really motivates the whole system today? So yeah, and Haynes, I'll probably ask some big picture questions too, but I just want to say that I've appreciated so much your time and your partnership with DocVocate. I really believe you guys are on track for great things. I probably know more than we could necessarily disclose in this call, but it's all super exciting and huge believer and fan in you. So really appreciate your time.
Thank you, Chris. And likewise, Leapfrog has now been with us 2 years, and it's been the best 2-year run for the company. And there's been a lot of ups and downs, even in the last 2 years, but coming in and been a massive stabilizing force for us, from resourcing up to resourcing down to just being with us yourself or him. All of the leadership has always been accessible and responsive. And I think for us, from someone in my shoes, especially me personally as a solo founder, but even for any founding team to have, you count your blessings when you find partners like that. We look forward to, we've been growing together. And I think as we go through our growth phase, we look forward to doing that together with you guys for the years to come.
Awesome. Well, thank you, Haynes. I've appreciated having you on the show, and I'm sure our audience will as well. One big picture question. We've learned a lot about the complexity of claims, transparency, perverse incentives, manual work, problems with heterogeneous technologies and policies. If you could take out your crystal ball, what would a better future state look like for patients to receive better quality of care and providers to be paid for delivering that care fairly and more easily?
I'm glad you asked that because I mean, a lot of the chats we're having, even with the founder stuff about having to understand the system, it makes it sound like it has to be that way, or sometimes it's a good thing, or it's a necessary evil in our system. And I think as entrepreneurs and as folks like yourselves that are supporting entrepreneurs, it's important to have that, that disruptor vision in front of mind. And internally, we call it the 2030 George Jetson vision of healthcare, right? For those of us that are old enough to enjoy the Jetsons.
Yep.
And so that vision effectively for the revenue cycle is patient goes to see physician in any context. That interaction is recorded, right? That recorded interaction is then automatically using AI turns into a coded claim, like we talked about, right? Then that coded claim is automatically with AI, say maybe providers AI, but with the payers AI, is all just kind of boop, 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 boop. Everything's kind of handled and coverage is affirmed and payments are all maneuvered. And in 99.9% of cases before I walk out the door, all that's kind of handled and all the notifications are in my phone and all the data is moved from system to system. That's the vision of it. And then if you mix in the regulatory, the lawyer side of me is looking at this is the part I'm less certain about happening. There's more pieces that are hard to control there. But I hope that the regulatory landscape and the policy-based landscape becomes much easier for folks to follow and understand, and for providers, patients, and stuff to implement, and companies and startups to implement, and stay on the cutting edge of. So that's our view, is that, at the end of the day, in healthcare is about providers and patients, right? I mean, that's just what it is. Whether it's a device, whether it's a facility, whether it's an insurance company, or us, a software company, we're all supposed to just be there to support the core of delivering care from one human physician to human, patient. And so, and that goes for government employees and lobbyists and everyone. We're all supposed to be here rowing in that same direction. So as an idealist, as a technologist, as a disruptor, my vision for 2030 is that we, have transparency and efficiency. We all get to focus on our lives.
Got it. Well, Haynes, I love that painting of the future, and happy to have you as one of those companies taking us from Flintstones to Jetsons.
Yeah, there it is.
Right.
There it is.
Okay.
Thanks. Yeah.
Haynes, thank you for your time.
Thanks for having us.
Thanks for listening to this podcast and being a part of this movement. This podcast is brought to you by Persimmon Health, an offering by Leapfrog technology that's purpose-built to help innovators imagine, build, and scale digital health products. We're passionate about fixing healthcare and have worked on over 50 digital health products. If you want to share your story or want to work together, please shoot an email to hello@persimmonhealth.com. Thank you once again, and I look forward to seeing you on the next podcast.